Hello, everyone, and welcome. I'm Deborah Waldrop. I'm the current chair of the SRPP section of GSA, and it's my privilege to welcome you to our member spotlight tonight. We're so very glad to have each and all of you here today. Thank you for coming. I wanted to begin by giving you the rationale that we had for developing a member spotlight. It grew from feedback that we've received from many of you after events that we as a section really value regular opportunities for connection and networking. We are, after all, the social research, policy and practice section. Our idea for today's event was to come together and to learn from the lived experiences and stories of two of our very revered members. Because at the core, it is the stories that connect us. So toward that end, the SRPP leadership team would like to offer very, very special thanks to Barbara Berkman and Rita Shula, who've agreed to share their experiences, their expertise, and their wisdom with us. To Dan Kaplan, who graciously agreed to serve as our host, and to our GSA staff representative, Caroline Adams, who helped make all this happen. So our format today will begin with brief biographies of each of our guests, followed by about 40 minutes of facilitated conversation, and then about 20 minutes of questions from you. There are just a few important housekeeping details to cover. First, our program, as you know, is being recorded and will be archived on the GSA website, so feel free to pass that along to anyone you know who wasn't able to join today. Please feel free to submit questions using the Q&A feature, which you can find at the bottom of your screen. You can use that feature at any time during the hour. So if you have a question up front, you can add it now. The chat will be open throughout the whole meeting for everyone to use, but please submit questions using the Q&A feature so that that makes it easier for us to retrieve them. And Dan will ask those questions at the end of the facilitated conversation. And then at the very, very end, at almost the top of the hour, I will share a couple of minutes worth of our ASM SRPP events that are up and coming very soon in November in Indianapolis. So let me begin with our biographies. Dr. Barbara Berkman is the Helen, Rehr, and Ruth Fizdale Professor Emerita of Health and Mental Health at Columbia University School of Social Work and was a research professor at Boston College Graduate School of Social Work for 8 years in retirement. She has directed 23 federally and foundation-supported research projects focusing on gerontology and oncology, and she was the principal investigator of the Hartford Foundation's Geriatric Social Work Faculty Scholars Program. Dr. Berkman is a fellow of GSA, and she received the Donald P. Kent Award in 2009. She is the vice president of Beacon Hill Village, an aging in place organization, and she serves on the board of the Beacon Hill Seminars, a lifelong learning organization. Dr. Berkman has been a member of GSA since 1972. Rita Shula is the director of caregiving with the AARP Public Policy Institute. She leads and provides content expertise on family caregiving initiatives throughout AARP and externally. Rita currently drives AARP's efforts in addressing systemic disparities and to build equity in long-term care for Black, Latino, Asian American, Pacific Islander, and LGBTQ older adults and their caregivers. Rita directs the Home Alone Alliance, a collaborative of AARP, whose aim is to change the way healthcare organizations and professionals interface with family caregivers, providing complex care. Rita spearheaded a multi-million-dollar grant initiative focusing on elevating the recognition and support of family caregivers who provide complex care. She's currently a member of the board of directors of the Association of Frontotemporal Dementia and the National Alliance for Caregiving. Rita is the recipient of Care 100 list of the most influential people in care of 2020 and the National Hispanic Council on Aging Caregiving AARP Award of 2019. Rita has been a member of GSA since 2009. And now, thank you to Dan for leading the conversation from here.
Thank you so much, Dr. Waldrop. Good evening, everybody. Welcome to this wonderful event. What an honor to have a chance to be in dialogue with Drs. Berkman and Choula tonight. We have prepared some questions, and I'm going to ask these questions of both of you. And as Dr. Waldrop indicated, everybody listening can use the Q&A feature to add additional questions that we will address in the final 20 minutes of our hour. So I'm going to start with the first question addressed to you, Dr. Choula. Could you please tell us about your career journey and what drew you to gerontology?
Thanks, Dan. And just before we get started, I appreciate the elevation to doctor, but I am not a PhD. I'm not a doctor. And part of that is my journey, right? I graduated with a BS in Information Systems Management and went right into the corporate world. As a researcher for an executive recruiting firm, and really thought that's where I was going to be, but really quickly figured out that I really needed to be around people. I needed to be in a mission-driven organization where I knew that I could make sustained life differences in other people's lives. And from that position, I moved into education. I was an assistant principal of an elementary school where I was able to support the faculty and staff, really caring for and teaching, educating kids from the ages of 3 to 13. So I think maybe I did earn some sort of doctorate just from doing something like that. But my life story really revolves around the next step. My grandmother started to fail in health and have, some significant health challenges. And then I realized the difficulty of trying to work and care for my grandmother at the same time. And so I made a decision to step back and do consulting. And it was in that time and that care for my grandmother that really kind of drew me to this idea of gerontology. It was that experience. I was raised by my grandmother. I was raised by significant other elders in my life. And so my career just kind of went with that. I ended up at AARP, where I had the opportunity to really know that I wanted to be in a place where I could focus on the care for older adults. And that's what brought me to this position today.
Thank you so much. I put in the chat, you're going to have an honorary degree tonight. And
appreciate it.
thank you for sharing the beginnings of your story and your journey into gerontology. And I'm going to ask the same question to Dr. Berkman. What is your career journey and what drew you to gerontology?
Well, Rita, I love the fact that you were raised by your grandmother, so we have something in common. So was I. But that had nothing to do with the journey to gerontology. I actually, I think we should start in 1965. I'm quite a bit older than you, so which I won't mention now, but I'll mention it more later. Anyway, in 1965, I was in the doctoral program at Columbia University, and I also was working half-time at Mount Sinai Medical Center. I saw myself as a health services researcher. I'd gotten a master's at University of Chicago and a sociology degree, and I wanted to do health services work. And at that time, in 65, we were doing little bits of data here and there. There were no computers or anything of that. And a miracle happened. Medicare was passed in 1965, and suddenly I had a dissertation. So the question that came up all over the hospital was, where are these elderly? Who are they going to be? What are they going to be like? Can we help them? And that wasn't just the hospital as a whole, but social work was very upset about that too. And so I wrote a grant to HEW, which was the precursor to NIH, for those of you too young to remember HEW, and also to a foundation in New York City who was interested in social work, which was interested in social work, and got the grants. And years later, actually, it took me a number of years till I got that dissertation done. It was about 300-400 pages by the time I was through. And I was writing papers like mad. I loved to write papers. And I was writing papers, and all of a sudden one day I got a telephone call from a woman I didn't know. And her name happened to be Rosalie Kane. And she said to me that she was editor of some journal, which I didn't recognize. And she wanted me to send my next paper there because she'd been reading some of the stuff I was putting out. By this point, I had a postdoc. And I said, I'd love to. And she says, but one more thing. You really are a gerontologist and you're not a member of GSA. And I truthfully, I don't even think I knew what the term gerontology was. and I certainly didn't know about GSA. And so I joined GSA, and that was 50 years ago. And the rest is history. I'm a gerontologist.
Thank you so much. In hearing about your experiences and how you came into your work, we are curious about the whole arc of your career. And my next question is about what are you working on now? What are you focusing on or paying attention to? What are you involved in? What piques your interest now? And I'm going to start with you, Dr. Berkman, and then we'll switch over.
Daniel, I don't think you ever called me Dr. Berkman in all the years you worked with me, but okay, it's Barbara. I'm more comfortable that way.
Sure.
Especially coming from you. Anyway, what am I doing now? All right. I am literally aging in place. I'm actually vice president now of the Beacon Hill Village, which is the first aging in place organization in the country. It's 20 years old this year. We're celebrating 20 years. And what am I doing there? Well, I'm vice president, and I take a real interest in the same question that I've always been interested in. What are the needs of people that can enable them to stay in place? Can we predict who cannot do this and who needs help to get a more supportive environment? I don't think this question has been adequately answered. So basically, I'm very involved with the village. The other thing I'm involved with now is takes me back to my years of teaching. I was asked, as soon as I retired from Boston College, I was asked to come and join the board of a seminar, lifelong learning group, because they believe that older adults need to keep the, what is it, Perot says, the little gray cells working. And so I'm on the board of that, doing a lot in marketing for things like that, and actually taking courses myself. Nothing related to aging and nothing related to anything I've ever studied or worked on.
Well, Barbara, you've always advocated for lifelong learning, and you're living your truth. So I'm glad to hear about what you're involved in. And Rita, how about you? What are you working on these days? In your introduction, there was such a huge diversity of interests and work and projects. I was like blown away by this. What's on your plate these days?
You know, I continue to be blown away about the amount of things on my plate these days. So it's an opportunity though, right? I am very excited at my current role and all of the things that I'm able to do. And, you know, I started out talking a little bit about, you know, what drives me, being mission oriented. And I have to say that it was just before COVID, I believe, and we did some focus groups and we were talking to family caregivers from different races and ethnicities. And a Black woman, I remember at the end, she said, you know, I really like doing these focus groups. I really like having the opportunity to share my story, talk about my challenges, talk about the differences that I'd like to make. And it's been about, you know, 3 years now that I've been doing these. And I just have one question. And I said, yes, ma'am, what is that question? And she said, when are you all going to do something so I don't have to keep doing these focus groups? And, you know, what really stuck in my head and what drives me to this day is that drive towards change. I think that so much of the work that I've tried to do, and I've had great mentorship with Dr. Susan Reinhard, Dr. Heather Young, Kathy Kelly from the Family Caregiver Alliance, and so many others that have been driven toward action. And so one of the things that I'm working on now, you know, I've always prided myself in really trying to talk about equitable care, quality of care, whether it's for caregiving, older adults, particularly from those from diverse race and ethnicities. And I have the opportunity now to do that at a federal, at a national level, but really more by driving a strategy internal to AARP, where we're working in 3 states to really look at Black, Latino, LGBTQ, and actually more specifically Chinese and Korean family caregivers in 3 states. And it's the opportunity to really understand how they are being impacted by access to services or lack of access to services in long-term care. And so by talking to the organizations that are supposed to be driving these services and providing them, but more importantly, talking to these older adults and their caregivers themselves. And it's not just the conversations, it's what we are committed to do, both as an organization, AARP, but in coalition with other organizations to really drive change and impact so that we're not having to keep having these same conversations with older adults, with caregivers, day in, year out, but they are really seeing substantive change. So that's something I'm very excited about and really much of my focus now.
I love to hear that. What a critically important time to be having that work take place in light of what our global societies have been through in the past few years, especially older adults involved in care. So that's wonderful. The next question is about, if you look back at your career, reflecting on your experiences, certainly there have been ups and downs. Everybody's career has those ups and downs over time. Could you share something, Rita, about a time in your career or a time period or an event that really felt like a mountaintop experience for you at the very top of when things were going well? And also perhaps a time that was a challenge for you, and how did you manage the challenge?
So I'm one of those that starts with the bad news first. So I'm going to go with the challenge first. The challenge for me was I can think back to this moment. I didn't share this in the beginning, but throughout my career, particularly at AARP, of the last 15 years, I've been a caregiver for my grandmother before coming to AARP, but then my mother, who lived with frontal temporal dementia. And I also had 2 young children at the time. They're still young, but they were born into this caregiving situation. And I remember we unfortunately we got to a place where we had to place my mom in a group home in our community. And I had just dropped her off the day before, got her situated. But as you might imagine, it was a very, very difficult time for her. Why are you leaving me? I don't understand this. It was hard. The very next day, I was returning to work from a 3-month maternity leave. And as you may know or might imagine, my daughter, I dropped her off. She's 3 months. She's screaming and crying and not wanting to let go of me. And I remember sitting in the car before driving off to work, and I just broke down in tears. I said, what am I doing? Like, maybe, I have so many people depending on me. Maybe I should quit. Let me just what do I do? And for me, that was a real inflection point for my career. I couldn't afford to quit. That just wasn't going to work, and it wouldn't solve anything. But B, it made me really realize the opportunity, the great opportunity and challenge that I had in my career at AARP to be able to speak to and help solve for these broken systems that left me crying in my car, right? To ensure that group homes and other environments, long-term care facilities where people had to be, that caregivers knew about that there was quality for older adults, really to be able to work with experts in the field to ensure that these things were happening. And so for me, that was my challenge, but that's how I overcame it. Like, I knew that, yes, this was hard personally, but at the end of the day, what I was going through would hopefully make that situation better for me in the long run and ultimately for others as well. I think a mountaintop experience really has been very recent for me. I've been very focused on my career. As I said, I have been a caregiver during that time and raising young children, but really have had a goal of being on boards and being able to expand myself in different ways. And recently, year before last, I joined the board of Association for Frontal Temporal Dementia, and just recently, the National Alliance for Caregiving. And I really am so excited about the opportunity to work with so many others in these really critical spaces that I am passionate about, but to be able to work in nimble organizations where I can help make change for people on a much larger trajectory. So that for me was kind of a confluence for all of the things that I had done through my career thus far. It's not over, but really being able to contribute in that way.
Thank you so much for sharing your personal story. And also in thinking about what you're describing about being in nimble organizations and have the capacity to influence the work of these kinds of organizations. It's very inspiring, especially for a lot of us who have academic positions, to think about what do we have the capacity to do in these kinds of positions? How is that different when you have leadership roles? So that's very helpful for all of us listening. Thank you. And Barbara, I'm going to ask you the same question about your illustrious career with many highs. What was your mountaintop moment, and what was the time when you were really challenged?
Well, let me tell you, the mountaintop is very easy, interestingly enough, and I've had a lot of them. But the one thing that always I relate to immediately, in about 1990, 1992, I was retiring. I was at Harvard Medical School in the Division on Aging, and I was retiring. Enough grant writing. I had done grant writing up to here, and there was a lot of years of grant writing, and it was totally soft money, and I was getting out of the business. And I got anointed. Columbia University suddenly called and offered me an endowed chair, family meeting, and they all said, "Go for it, Mom." My husband said, "Go for it." Why? We all love New York. So, all right. I moved down to New York, to Columbia, and that was 1996. And then in 1999, I had written a grant to the John A. Hartford Foundation to develop the Hartford Geriatric Social Work Faculty Scholars Program. And we got the grant. The grant was the legacy of my life. I was able to create a grant with fantastic mentors, with incredible faculty scholars that we chose, each one of them better than the next. And we were able to mentor and to give them enough money that they were able to get their pilot work really underway. And they were to become the inspiration for faculty and for young people to follow in their footsteps and to become faculty in aging. Social work at that point there were a few of us left, Rosalie and I, Ruth Dunkel, there were a few of us, but we said we have to replenish ourselves. We need to replace ourselves. And so I got that grant, and I had the wonderful experience of working with Linda Herudian at GSA for, well, it ended up being almost 17 years, and I'll tell you why. Because right after the Hartford Scholars Program ended, we had aging, Institutes on Aging that we created together, also funded by the Hartford. Linda Herudian, and then I had this incredible number of wonderful young people who just took me along on a silver platter, I swear. I couldn't have done it without them. This gentleman here asking me questions is one of them, Dan Kaplan. And then there was Dan Gardner. There was Ernest Gonzalez. There was Peter Marimaldi and Brad Sodakoff and Susan and D'Ambroso. And I'm sure I've missed somebody. I hope I haven't, but I'm sure it was a lot of years. And these young people who are now, Dan is associate professor, Ernest is associate professor. I have deans out there, Deborah Waldrop. I mean, it's just been incredible to me. And that's a mountaintop and will always be my mountaintop. Interesting, Rita, what you say, because I'm exactly with you. The biggest challenge is balancing a career in academics. I was an academic. How do you become a big deal in academia? You write, you do data, you do your research, you're giving lectures, you're on the speaker's trail, you're going to conferences, you're networking. How do you balance that with a family life? And this is not easy. This was probably always been my challenge. I'll never forget once I was getting an award from, I think it was NASW at that point. I was getting a leadership award or something. And my daughter, one of my daughters was there, and she said, well, now I know where mom was at all those important occasions. I said, okay, stick the knife in me, you know. And I think the thing is that learning how to balance and how to prioritize is so difficult. And sometimes you make mistakes and sometimes you don't. I ended up, well, I was getting my dissertation. I had a 13-year-old and I had a baby with special needs. And so I had to work a lot from home. So I had a lot of help, family help, my mentors. I had Helen Rehr at Mount Sinai, and then later Eleanor Clark at Mass General. And these people enabled me to work from home on, you can imagine, you could work from home on data, no computers, remember. And they've had a system of people coming and getting the data from me and me going to the post office and mailing it back. And I was able probably to produce as much as I ever will produce during the years when I had to be home and be a mom. And it was not easy. And I always sort of envied my friends in academia who were traveling the world, you know, and I was, anyone would ask me, can I go here? Can I go there? And I'd say, well, I went to Australia once in 5 days. I mean, went over, did the paper, got back, almost killed myself. But all I could think about is I can't leave my kid that long. So what you're saying, I think, Rita, is absolutely true. And it probably hits, I know every woman and probably some men. How do you balance the family career and the career?
Thank you both so much for that. Barbara, the Hartford Social Work Initiative, the Hartford Gerontological Social Work Initiative, has probably touched the lives of just about everybody in this meeting, in this section of GSA as a whole, because of the influence of the members of the section. So it's been an incredible contribution and has helped so many of us in our journeys and our careers. You both spoke about mentoring in your careers and how important that was, and the family life balance, which we all care so much about. And so my next question is, what advice do you have? I'm going to ask you, Barbara, first. What advice do you have for emerging scholars who are looking ahead to a long career that they hope will be successful? What advice, looking back at your own journey, would you give to these emerging scholars?
Okay. Now remember, I speak from the, this is going to be interesting because Rita and I speak from two different arenas. And I speak as a researcher from day one. I got my master's degree at University of Chicago, and you had to, it was very different back then. I majored in research, and I never had a job after that. Clinically, I think 6 months at Community Service Society in New York while I was waiting for school to open. So everything has always been research. So when I speak, I'm going to speak from that perspective. Now, for the young researchers out there, and Daniel probably could tell you what I'm going to say because I say it all the time. Stay on trajectory. Pick an area that excites you, that is meaningful to you, that you love, and that's also has great meaning for society, for practice, for policy, not just for research, not for the ivory tower. This has to be meaningful to you and the community. So stick to your trajectory. There are always times when people are trying to pull you this way or that way, and it's very easy to get distracted. Always think about what your specialty is and whether or not it fits in that area somebody's pulling you into, particularly in schools and social work where they're constantly pulling you into administration. That's all right, but make sure it's the kind of administration where your expertise and who you're going to be known for fits there. Then the other thing I'd say, disseminate. Do not put that paper in the drawer and forget it. Write. Go to every meeting that's appropriate and present your data, network, get to know people, have them get to know you. Be the person, the go-to person eventually, just as you now should go to people that are your field. You may be the only person in your school who is in one area, maybe the only person, but all over the country, there are going to be people just like you. And what you need to do is connect with them. You connect at meetings, you connect through your mentor. Your mentor will have people they'll connect you with. And so really it's two words, it's trajectory and it's dissemination.
Thank you, Barbara. I feel like you were speaking to me yet again about these with this advice. Rita, how about you? The same question. In your experience, what advice would you give to emerging scholars in the SRPP section of GSA or elsewhere about building a long and successful career? Oh, it looks like Rita's picture might have frozen, so maybe there's a signal issue. So let's hope that she reconnects with her signal in a moment. Oh, there she is.
There she is.
Am I back?
You
Sorry.
are back. Did you hear my question? I'm glad
I
you
did.
Okay.
Yeah,
Okay.
sorry about that. No, I was just saying, I think this is a great question. And, I probably didn't take Barbara's advice. I did not stay the trajectory. I kind of went up and down and all around. But what I did was I stayed true to myself. I was very anchored in knowing that I was mission driven. I was very anchored in knowing wherever I needed to be and whatever moves that I needed to make really needed to align with what my goals were. And I think it's important to really be clear on that. And your goals may change as you grow, as you have a family, as you don't have a family, as you decide to move, or your interests may change. But there's some core principles that you as an individual have, and staying true to those, I think, is very, very critical. I think another piece is finding good mentors. One thing that I will say about mentors is I think it's important to have more than one mentor. I think it's important to say, I may be in this particular field and I need a mentor in that field, but how does that field intersect with other areas? Are there other mentors that will challenge me in other spaces to be able to think broadly in many situations? I think one thing that I really appreciate and I really try to stress in my own career is that I don't stay siloed. I think it's very easy to stay really focused on one core thing and not see how it intersects with others. When we're talking about being mission driven, when we're talking about making a difference in people's lives, we have to remember that people aren't just one thing, right? They're holistic. And so if we look at our work in a holistic fashion, how does that drive us to not get comfortable sometimes? How does that drive us to challenge ourselves and to do things that may not feel so good at first? And I'm not talking about something that will cause harm, but it may feel uncomfortable. It may stretch us. And I have to thank Dr. Susan Reinhardt. I'm not sure if she's on or not, but she taught me that. And she has stressed to me by action, by giving me things that when she gives me things, I'm like, in my head, I'm like, I can't do this. I'm not thinking about this. But I'm pushed, I'm stretched. And in so many ways, the ability to be stretched like that has allowed me to grow in my career and has allowed me to interact and intersect with so many other individuals that I would not have normally done that because I'm not a researcher. My goal is to bridge policy and research or policy to research. But the only way that I'm able to do that is recognizing the ability and the need for others. So that's what I would say is find a great mentor, a couple of great mentors, stay true to yourself and really stretch yourself. And as you can, don't get too comfortable.
All of this advice is so rich. And Rita, I want to tell you in the chat, we have a note from Susan saying, I am here, Rita, you mentor me as well. There's lots of nice messages coming through in the chat for you, for both of you. So my next question is about GSA, because we are together in this community of practice. because of the existence of GSA as a professional society that we belong, many of us for many years, some of you for many, many years. So my question is, how has being a member of GSA influenced your career? Rita, can we start with your answer?
Sure. I'll say it again. Research is not my background. I am not at my core a researcher, right? But the ability to be in an organization like GSA where the predominant membership are researchers has truly influenced me and influenced my thinking because so many of the scholars in GSA are able to come at everyday issues and problems, and they've spent their life's work, or they're just beginning to look at these issues in a way that I wouldn't have. I wouldn't have had access to individuals in this way. I wouldn't have thought about it in this way. And so for me to be able to hopefully take from the learnings of their great work and be able to apply it is something that is so important to me. And I have to say, I am just so amazed and in awe of so many of the younger researchers now and their ability to actualize and move forward on issues that are not always the easiest to do. And I'm speaking specifically about those. I'm going to take this opportunity now to talk about those working in the equity space. It is not easy, whether you, particularly if you are a person if you're Black, if you're Latino, and you are not in the majority in that room. And what I am seeing from some of these researchers that I am very privileged to work with, and how they are owning this moment, they are owning this work, and they are truly doing work that is going to change the trajectory. I get emotional, as you can see, thinking about it, but I am so inspired by their ability to work through the challenges and say, you know what, we're going to own this and we are going to make this change. So GSA is a part of that, and it's allowing individuals like that to be cultivated. And so I'm just so honored to be a part of an organization and to be surrounded by so many amazing senior leaders as well as those that are emerging. It just truly is amazing.
Rita, thank you so much for that particular message. It rings true for so many of us that there's a shift happening, and being immersed in these environments like the GSA conference and hearing people pushing for change and being surrounded by the movement of change, it feels like a great honor to bear witness to it, to be invited into it. And I think your message is very powerful, and I thank you for sharing it. Barbara, I'm going to ask you also about your years as a GSA member and how that played a role in your life, in your career, in your connections. And there's AT.
Yeah, he just wandering around.
Just get my glasses.
We all know AT.
Hello, everyone.
You can see how much he listens to me. I told him he can't come out here. Well, here he came. He needed his glasses. First of all, as you all heard already, GSA became my professional home. This is where I met all my colleagues, all my dearest friends today. I met them all through GSA. But the other thing about GSA that is different and absolutely so significant is that it's interdisciplinary. Rita, you talked about a holistic person. I have always talked about the fact that a patient or a client has to have the input from multiple knowledge bases. And at GSA, you're in the room with the medicine, nursing, social work, economists. It's just, you get the ability to learn, as you said also, from everybody together and share your work. And that is so significant for your future. This is how you end up creating positive change, is because you work with many people. I think at the Kent Award, what I said was, it's time for total interdisciplinary connection. This is where we're at, and this is where we need to be. So I love GSA. I remember Dan Gardner and I used to sit around and have a drink after some of the meetings and talk about all the people we had met and how much we loved it. It's just a marvelous, marvelous organization, and you become a family there. You really do.
Thank you both so much for answering these questions. We have a number of questions coming in from our audience as well. And so I'm going to share some of these questions with you now. The first one says, in this time of unprecedented population aging, what issues do you think are the most important priorities for policymakers, practitioners, and researchers? One or all of those? And I'll just open that to whomever wishes to answer.
Well, I'm going to start by saying, since I'm in an organization that ages in place, and the government isn't very interested in funding us because we're healthy, basically healthy elderly. But not everybody aging in place is healthy. Not everyone is Barbara Berkman out there on the treadmill and out there and doing this and doing that. And people need to be able to finish their life with quality of life. The average age of Beacon Hill Village members is 80 years old. 20 years ago, the average age was 67. So we are dealing with the issue of needs. What do we need to help these people, to help all of us be able to stay in our homes as long as possible? And I think that that is something that the policymakers have been ignoring. You know how much cheaper it would be, and I think Rita can talk to this, how much the difference it would be to enable people to stay home than to have them going into assisted living, and if they can afford assisted living anymore, or into nursing homes. It's really problematic. I remember when Ruth Dunkel years ago started an aging in place community with Medicaid and in Detroit. And that was a major struggle, which I don't know where she's at in this now. It's been so many years since we talked about this. Because aging in place organizations started, as I said, 20 years ago. But I think this is an arena of enabling people to stay at home as they age with quality of life is so significant. If it's possible for them to want to, and with, maybe just some types of help. Our people need help. Not all of them are as healthy as you'd like to think.
Thank you, Barbara. How about you, Rita? Top priorities?
Yeah, I would say care, care, and more care. I mean, we need a care infrastructure. We need to know that if we are going to have older adults age in place, many can age in place on their own. Many need that support of either a direct care worker or a family caregiver to be able to support them, right? To be able to help them. As we even look at those issues around family caregiving, I talked about being that parent trying to figure out how to make it happen. If we don't have things such as paid family leave, if we don't have access to direct care workers, if we don't have employers that are supporting these individuals, then we don't have the care that we need, whether an older adult is in community or whether they're in a long-term care facility. And so we have to focus on what those needs are. Yes, we have to come at it from a policy perspective. We need policy to make things permanent. We need policy to make that change. But we also need the good work of researchers. And this is where I make a plea. I think it is so critical, and I see it happening more and more, which is wonderful. But we have to make sure that as we are doing our research with caregivers, with older adults, that we recognize that we are a society, we are a world that is full of a variety of cultures. And if our research does not reflect broadly what those experiences of individuals are, then how do we develop policy? How do we develop programs that really are meeting the needs of LGBTQ older adults and caregivers, of Black caregivers, of rural caregivers? And so it's really critical that although it's difficult, and I understand it can be difficult, that we have to continue to push in this space so that our work and our research is very reflective of the population that we're trying to serve.
Rita, you're speaking directly to a research audience with this message. And one of the questions that came through is directed specifically to you and about this very issue. What advice, it says for Rita, what advice do you have for scholars who hope that their research can influence policy and practice?
I think it's really critical. I'm going to go back to something that Barbara said about not putting that paper in the drawer. I think it's really critical that you use avenues, that you seek out programs, and that you seek out collaborative opportunities with organizations. Like I said, I'm very pleased. We have an equity advisory board at AARP in the work that we're doing. And we've been able to pull in, and I think all of them are GSA members, some of them on this call now, I'm sure, that their research is what is informing our policy and our practice. And so it's the going to conferences outside of GSA, becoming an expert and pushing yourself outside of that comfort zone so that others know that you're an expert in this space. We're in a really critical time where finally there is a need. We're seeing it from policymakers, we're seeing it from corporations and other private for-profit entities, that they do want to know how to influence in this space. They do want to know how to build programs. We see it from funders as well. So it's, again, I think it's a combination of seeking out mentors that can help you in this space. I feel very blessed to be able to mentor individuals in this space and make those connections. I'm in rooms that some people may not be in rooms, but if I know about your work, if I'm looking at Twitter, if I'm looking at Instagram and I see your work, I can speak to what you are doing. And I can say, this individual would say, I've never heard of that individual. Well, I have a paper for you. That's what I like to say. And so to be able to make those connections, again, it's important to step out of that probably comfortable research zone that you're in and really be able to network and influence to get yourself out there and promote.
Fantastic, thank you. This question has some bite to it, I think. It's very applied. All of us have a role to play in influencing the workforce through our teaching, through our service, through our involvement in organizations. So here's this question. The field of gerontology is about how we are all aging and changing over time. When you think about the need for a well-educated and prepared gerontological workforce that'll take care of us and the people we love, what qualities do you seek in the health and social service providers of the 21st and 22nd centuries? What qualities do you seek in the providers of the future and providers of today? This is for either of you.
I think one thing that we've alluded to is the fact that you treat, and I think Rita used the term holistically. We need to have providers who respect each other, who understand what each profession does and contributes and respects what they can do. And that way you have a much more realistic approach to medicine and nursing and social work. And you need to have respect and interdisciplinary work together to make that whole person get what they need. It isn't just one thing. One social work alone cannot help that person. Medicine has found they can help, but right now, when you look at the hierarchy sometime in healthcare, you say nobody's talking to the other person. It's all competitive for the buck. And that's been going on forever. I don't know when that's going to change, but we really do need to have great respect for each other's professions. And I've always even said we have to bring administrators in on some of our meetings and get them to understand what's involved. Too often they stick to the numbers. They're looking at numbers and pushing the numbers. They don't really understand what the whole team needs. They should become a member of the team. I don't think they put administrators on the teams enough. Rita, it's up to you.
Yeah, I will put an exclamation point, maybe like 5 of them, on everything that Barbara just said. I mean, we did some work over the last several years where we were visiting health systems across the country, and we were trying to see how they were implementing legislation called the CARE Act that AARP has been behind and led. And what we learned from that, and they learned from each other, is that we pulled all of these individuals that Barbara talked about. And yes, it was in a health system, a hospital setting, but we pulled the pharmacist, we pulled the bedside nurse, we pulled the nurse manager, we pulled the executives, the C-suite, all into the same room oftentimes, talking about that experience of the family caregiver. We pulled the social workers in. And what we learned, and we knew, but what they even learned from each other, was in order to make impact and in order to make this work for the people you're trying to serve, that you have to work together. And I love Barbara saying the respect piece, right? We have to respect each other. We have to respect that there are individual roles and expertise, but we have to come together to build a solution, because I'm that caregiver sitting at the bedside. I see everybody looks the same. You all have the same clothes on, right? You all have the same uniform on. All I know is that I need help. So how do you all work together in order to provide those supports? And I think ultimately it also goes back to, I want to say, to C-suite executives and others to then provide that support to their employees. We know that providers in this space, we saw it during COVID, right? We saw it in nursing homes. We see it in nursing homes and other long-term care facilities. They are worked hard. Where is the support for those workers, those providers themselves, so that they're not depleted, that they have the opportunity to grow and to learn and to move forward? So like I said, everything that Barbara said with exclamation points and a little bit more.
Thank you. We have a question here. I'm curious how Rita and Barbara, you'll answer this similarly or differently. What would be your advice around the top tips or strategies that work when communicating with policymakers?
I mean, I'll jump in. I think one thing that's really critical is you have to be able to tell a story. It's not enough just to go in and say 50% of. You have to be able to speak to that policymaker in a way that you're making a case, that you're telling the story of their constituent that they just saw in the grocery store, or their constituent that they're sitting in a faith-based community with. And so it's really important. We're here talking about research. The quantitative is critical, but so is the qualitative. And so to be able to merge and to really think about it in that context, to, again, I'll go back to my word holistically, to be able to be able to speak very directly and be able to share the stories of those that are influenced by them, I think is important. I also think that it's important to work in coalition. We can't just go in by ourselves. If you're talking about dementia, if you're talking about nursing homes, as you will see, we're in meetings all the time with each other. And so where can you, or who can you build coalition with, that you're going in together to talk to that policymaker, so that it's not just one individual or one entity?
Love that. Thank you.
All I can say to that, Rita, is amen. I mean, you hit it on the head. When we had the Hartford Faculty Scholars Program, one total segment of it, a significant segment that Linda Herudian actually created and it's part of it was part of GSA, the people at GSA, was on how to speak to policy. We took people up the hill and they made their appointments with their legislators or their senators, whoever they could get into, staffers most of the time. And the point that you're making about tell a story that relates to them and their community, like you said, that was probably one of the most productive parts, one of the very productive parts of the Faculty Scholars Program. Daniel, you might want to relate to that. Daniel was too young to be a faculty scholar, but he worked for the program for how many years? 6, 7 years, and went to all those meetings. So you want to add something to it?
I got to go to 7 or 8 policy institutes, not just one. No, absolutely. To build the confidence to know how to tell that story, how to make that impact. And Rita, your point about coalitions and larger voices and amplifying the voices of our clients, our research communities, is so much more powerful than just talking in the numbers.
Well, Brian Lindbergh is in the audience, and Brian was the key to the policy. He and Linda worked together and created that policy institute.
It was very powerful. Hi, Brian. This is the time in the hour when I'm going to say that it has been my great pleasure to have a chance to speak with you both tonight and to hear about your work and to receive graciously your advice. So thank you so much for that. And I'm going to turn it back over to Deborah Waldrop now. Thank you.
Wow, what a profound and meaningful hour this has been. I just want to give my heartfelt thanks to Barbara, to Rita, to Dan for all of this opportunity to learn, for the wisdom you've shared, for all of the wonderful advice. It's been a really, really wonderful experience. And I'm hopeful that it has been for everyone in the audience. I would like to invite our audience to use whatever means you feel most comfortable with. The chat, where you could add a note of appreciation and thanks to Rita and Barbara and Dan would be really lovely and very much appreciated. We'll save the chat for them. I'd also invite you to use your reactions feature and applaud, which we would do if we could be in person, but just please find a way to express your gratitude for this past hour. And while you're doing that, here come lots and lots of claps up, I see. That's lovely. While you are doing that, I'm going to share my screen and invite each of you to think about all of the wonderful GSA events and opportunities that we have coming up in just less than a month. So that you can be mindful of these. These will come to you in an email blast as well. But I just want to be sure that you know, first of all, we will be having both an online SRPP business meeting. It'll just be an hour. We shortened the agenda enough to build in networking time. We'll also have an SRPP business meeting and luncheon. It will be our first time to be able to be together in person since Austin. I get choked up thinking about what that's going to be like, to be able to see all of you and to be together as a section. We also want to celebrate Namki Choi, who is our Maxwell Pollock Award lecturer. That's on that same Thursday. There's an interdisciplinary panel on geroscience and policy, and we'll be represented by Rich Bortinsky, who is our panelist. There's a member from each section. And then there will be the Presidential Symposium on Saturday, which is an incredible opportunity to learn from current scholars across the disciplines, so across our disciplines. So I invite each and all of you to put those events in your calendar. I thank you again for your participation tonight, for being here, for your questions, for hopefully all that you took away. And we, the SRPP leadership team, looks forward to seeing each and all of you in Indianapolis. Thank you so much. Have a good evening.
Thank you.